Welcome to PAMED Talks, a podcast brought to you by the Pennsylvania Medical Society. I'm Dana Lombardo, PAMED Outreach Specialist. Today, I'm joined by Dr. Tejas Nikumbh, PAMED's Resident and Fellow Section Vice Chair and Trustee. Today, we'll be discussing his leadership journey through the RFS section, upcoming section elections, his experience with the recent visa freeze, and his recognition as a top physician under 40. Welcome, Dr. Nikumbh.
Thanks, Dana. Thanks for having me at the PAMED Talks. I'm looking forward to this.
Absolutely. We're excited to have you here. Before we dive into some of those topics, can you give our listeners a quick introduction of who you are, what you specialize in, and a little bit about your background?
So my name is Tejas Nikumbh. I am an internal medicine resident at the Wright Center for Graduate Medical Education in Scranton. I'm also the chief resident here for the research and scholarly activity. And my background, I'm an international medical graduate from India. I completed my medical training over there, did my med school and residency before moving to Northeast Pennsylvania to pursue my current training in internal medicine.
So let's go back to the beginning of your journey with PAMED. When did you first become a member and what prompted you to join?
It started when PAMED came to my residency program 2 years ago. The Right Center transitioned into an institutional membership model where all the trainees were automatically enrolled with PAMED. And I remember back then the PAMED staff and the past president hosted an initial program at our center to introduce their advocacy and leadership frameworks. And I have always found that there is a lot of professional and personal value, and it's kind of inspirational to engage with all the peer learning networks and the medical societies. So, after that introductory session, I chose to pursue active involvement with the PA Medical Society.
When you kind of got your feet under you and really understood what PAMED was about, what inspired you to run for a leadership position at RFS?
So initially, I was elected as the Residents and Fellows Vice Chair for the 2025 Governing Council. So what really inspired me to take this position was to see how organized medicine actually works under the hood. What we do is just at the front end when we talk to the patients or kind of treat them, but there is a lot of things that work underneath which we are not aware of. And the residents and fellows section basically is the official home within the PA Medical Society for the residents and fellowships who are currently training in Pennsylvania. And it's a considerably large workforce. There are around 9,000 residents and fellows in training. And when you realize how massive that number is, you understand our collective workforce is the actual backbone of healthcare delivery in Pennsylvania. What got me involved was, again, like I said, the chance to make some kind of positive impact or a change in the way the residents and fellows are being trained and give them a stage to be able to bring forth their problems they currently face.
Great. And I know from an outside perspective, RFS can seem large and a little bit confusing. So if you had an incoming resident or fellow who was on the fence about getting involved, what would you say to kind of tip their decision to joining us in our meetings?
I would say that the residents and fellows section is just not another committee, or it's not going to be another line in your CV. It's an official legislative vehicle for all the 9,000 trainees across Pennsylvania. It serves as our collective voice, allowing us to advocate directly for our unique needs. Uh, it, for the listeners, I would say that the value of RFS is that it prevents you just from being passively consuming what healthcare gives you, but instead it provides a direct mechanism to write resolutions, testify, and actively shape the policies that govern our daily professional life. So that's a lot of value. And I think the camaraderie we have at the RFS is also one of the pluses. We tend to enjoy all the time we spend together. coming up with resolutions, getting to know each other. Uh, that's one of the biggest plus. So if you're on the fence, you can come in for all the advocacy work, but you will definitely stay for all the camaraderie we have here.
Now, I want to shift to something that's been deeply personal for you. As our listeners may know, at the beginning of this year, the US Department of State paused visa processing for immigrants from roughly 39 countries. The J1 visa waiver, which forgives the 2 year home country physical presence requirement and allows applicants to transition to an H1B visa, was affected by the freeze. Early May, the US Citizenship and Immigration Services made an update to their website to reflect that they've resumed processing visas and work permits for physicians. This significantly impacted international medical grads and physicians in the US here on work visas. Can you share your experience and what that period of uncertainty has been like?
So what happened was, like you said, there was a visa freeze on processing of J1 waivers, and this kind of brought in a lot of uncertainty, especially for me. I'm a final year internal medicine resident, and I'm preparing to transition into practice. And my timeline post residency was like completely disrupted. Uh, and during this time, you have to kind of deal with a lot of regulatory issues, also a lot of uncertainty regarding whether you can legally remain within the country after finishing your residency program. So all this kind of has a lot of impact on like everything you've done till now in order to get your first job. It gets impacted, and it was really a very kind of a difficult time to me professionally. Yes.
How was your cohort able to support you during that time?
Everyone who is an international medical graduate by now knows that you have to have a very strong personal and professional network in order to get where you are till today. This is not the first time most of us have dealt with visa issues, so we kind of anticipate that. But I think PA Medical Society was also like very helpful to me personally and to a lot of my colleagues to be able to navigate through this difficult situation.
Were there resources or people at PAMED who helped you navigate it?
Yes, I mean, the most critical resource that PM Medical Society provided during the freeze was its direct channel to the state and national legislative advocacy networks. So, individuals who are facing these immigration delays virtually have no leverage at all, but organized medical society can amplify those concerns instantly. And through PMED government relations team, we were able to ensure that the operational impact of this freeze, like specifically how it threatened to disrupt patient care and could worsen the physician shortages across Pennsylvania hospitals, was communicated directly to the lawmakers in Capitol Hill and through our uh, other organizations we work with, like ACP and AMA as well, were able to amplify those voices.
What do you wish more people understood about how this issue affects physicians, either personally or professionally?
I wish more people understood that this is fundamentally a workforce stability and a patient access issue. It's not just an administrative or immigration hurdle. The IMGs, the international medical graduates, make up a vast portion of the frontline healthcare workforce. And frequently, we serve in rural and medically underserved areas across Pennsylvania where the shortages are very acute. So when the visa processing stalls, it creates a kind of cascading crisis for the hospitals, and clinics will lose physicians. And hence, it is very important that there is someone who is helping out physicians in such incredibly stressful situations. So I think ensuring a predictable and stable regulatory pathway for the international medical graduates is like essential to maintain the continuity of care for our patients in the communities.
Thank you, Dr. Nikumbh. I really appreciate you giving us a glimpse into such a personal matter. Before we move on, I do want to remind our listener members that if you are still being affected by the visa freeze, we do have resources available. Visit us online at pamedsoc.org/on-the-hill for information on how to stay in touch with important advocacy issues and sign up for text alerts. So, switching gears to a more celebratory note, we wanted to give you a big congratulations on being recognized as a 2026 PAMED Top Physician Under 40. This award is presented annually to a select group of PAMED members that have been nominated by their community. The award focuses on those who make a significant impact on their specialty or community, are innovators in advancing the practice, research, or education of medicine, and who are leaders who inspire others with their dedication, compassion, and expertise. What did that recognition mean to you?
It didn't come in as a surprise. You just wake up one morning and there is an email saying that you have been selected. So it was pleasantly surprising. I'm very thankful to the PA Medical Society. In this having this award, this recognition is more of a validation for the collaborative work that we've been doing, especially in Northeast Pennsylvania. Uh, so. Uh, what happened was we were able to start a street medicine program at my residency, the Right Center for Graduate Medical Education. And we were recognized by PAMED for those efforts. So, more than me individually, it reflects the work that has been carried out here in Northeast Pennsylvania. And I'm really thankful for this recognition.
Is there any specific mentor or specific experience you'd point to as particularly shaping the kind of physician leader you've become?
The experience that has most heavily shaped my approach was launching and operating the street medicine program. And the impact of taking care outside the hospital walls, it was tremendous. It teaches you quickly that true medicine actually happens outside the clinic, where social determinants of health kind of dictate all your outcomes. I mean, it is incredibly gratifying when you can step in to save someone who is losing a limb because of a frostbite because they were outside in the cold and did not have a shelter. So it's also very incredible to just prevent someone from having a stroke because you were able to prescribe them a simple antihypertensive. Things that we assume everyone will have access to, but is in reality the things are much different. So that perspective kind of definitely shapes how I approach the entire way I practice medicine. So it has been very impactful for me personally.
What advice would you give to other young physicians who are early in their careers and trying to figure out what their niche is and how to make their mark?
My advice to young physicians will be to realize that at its very core, medicine is not just science, but is a profound exercise in humanity. While our early training focuses heavily on clinical algorithms, diagnostics, pathophysiology, management, the actual practice of medicine happens when you step into some individual's life. There is a lot of things that are not taught in your med school or in residencies that you will see will come into play when you actually practice medicine. So, like I said, building the street medicine program was one such exercise where you get to see that human vulnerability is something you have to take care of as well, not just the medical condition. And the other thing I would say is like, let's don't wait for like some official title or a formal leadership role to address the structural gaps that you see in care delivery. I think when you identify a systemic failure or a community need, you should try and leverage all the organizational support you have to bring in solutions. And because ultimately it's we, the physicians, who are going to advocate for our patients.
Speaking of leadership opportunities for residents and fellows, I wanted to talk a little bit about our upcoming 2026 House of Delegates. I know you've been involved in the HOD process for a couple of years, and I can seem a little bit mysterious to those who've never attended before. Can you walk us through what your experience has been like and what advice you'd give to an RFS member who's attending for the first time?
I think this last year it was the first HOD which I attended, and being involved with the resident and fellow section governing council, kind of it was a nice journey where initially I wasn't aware what a resolution is or what even it means. So it started with learning how to write a resolution. We have workshops which teach the residents and fellows how to do. Like the background research to be able to write one. The staff at PA Medical Society is very helpful when it comes to that as well. So you write a resolution, you debate on that, and after submitting the resolution, you take it to the House of Delegates where there is further uh, deliberation about whether that resolution should be passed as a PA Medical Society policy. So when you see a journey of a resolution, you kind of start valuing it more and the number of changes it goes through, it ensures that it is impactful in the Pennsylvania Society's overall direction which you're given to the medical society. So yeah, it is very gratifying to see how you are able to impact healthcare at large. And if anyone wants to have that kind of impact, then PMED Society is like exactly the place you want to be at.
I want to take a minute to remind all of the RFS listeners that the RFS annual business meeting will be held on Monday, October 12th at 7 o'clock p.m. Please register on the section's landing page at pamedsoc.org/RFS to register. That is a separate meeting link than our normal monthly meetings. And in addition to discussing the resolutions that are going to be presented at HOD, this meeting is also where we would hold the elections for the RFS governing body. So this year, the RFS is going to be voting on the following positions: chair, vice chair. There are several member-at-large positions that are up for election: the secretary, the PAMPAC representative, and then finally the tentative RFS slotted alternate delegate to the PA delegation of the AMA. Dr. Nikumbh, before we wrap up, is there anything you want to leave our listeners with that we haven't touched on yet?
So, I mean, I want to leave our listeners with a realistic reminder of what at stake. I mean, the resident and fellow section is the legislative vehicle for 9,000 physicians that are trading across Pennsylvania. Every systemic issue you face during a shift, whether it's an administrative hurdle, an inflexible contract structure, or barrier to patient care, is an issue that can be systematically addressed through organized medicine. So when we established the previous years through all the resolutions that we have written, I think it is clear that it is our responsibilities that do not end when a patient leaves our clinic doors. So, so bring your clinical frustrations to the PA Medical Society. We will definitely work on solutions for them, and we'll try and fix some of these problems at the RFS annual business meeting and at the House of Delegates. So I'm looking forward to working with each and every one of you.
Thank you, Dr. Nikumbh, for joining us. We really appreciate you taking time out of your day to be here. For our listeners, if you want to learn more about the PAMED Residents and Fellows section or the upcoming RFS elections, head over to pamedsoc.org/RFS.